Yes, we are coming to you live from the Polo Lounge at the Jamaica Pegasus Hotel. I am Trevor Monroe.
And I am Delano Severett.
We're continuing a discussion with Dr. Robert Robinson, who is the CEO of Immunoventure Products Limited. We're talking about diabetes. Robert, Immunoventures, you have products that deal with this.
Yeah, we formulate products that will help a lot in improving and reversing diabetes. We have probably 3 products that will help in diabetes.
Tell us about them.
All right, the first one we have is the Immunogizer Fat Reducer. As I said, obesity is often associated with diabetes. In fact, there's a move to change the name diabetes and obesity to diabesity, because most people are who are obese who are diabetic are also obese. So 75–80% of persons who are diabetic are also obese. And as I said earlier, that the problem of diabetes is not only a problem in regulation of sugar, but there is also a problem in regulating fat. And what we find happening in the diabetic person is that they're not accessing the fat, and because they're not accessing the fat, there's accumulation of fat and obviously obesity as such. Now, our product, the Immunogizer Fat Reducer, increase the accessibility of fat, and that is very important, because if you can access the fat, not only will you be burning more fat, which will improve your diabetes, but in a sense you are relatively resting the glucose system, because you're using more fat, you're using less glucose, so therefore you're allowing more regeneration and repair in the damaged glucose regulatory system. We also put in our products things that increase insulin sensitivity. We have a supplement called Calcones, which comes from cinnamon, which increase insulin receptors sensitivity. We have that in our Immunogizer Premium and also in our Immunogizer Fat Reducer. So you get 2 benefits there if you're taking the fat reducer, in terms of losing the fat and also improving the sensitivity of your body.
What's the regimen you undergo? I mean, if say the Immunogizer Fat Reducer, is it every morning, yes, and evening? What's the kind of regimen that one undergoes with that?
Okay, for the Immunogizer Fat Reducer, it's really a 2-in-1 product. We have Immunogizer, which is the prebiotic, which helps to protect your bacteria from the negative effects of preservatives in your food. This is very important, because
you can say that again. Almost every food now have double, triple preservatives.
That's right. So you need to neutralize that so the bacteria can be healthy. And the bacteria play a major part in your healing system. So one of the benefits you're going to get also by taking the Immunogizer product with your food is that you improve the immune system, which will obviously improve your chance of preventing infections and controlling infections, which in fact worsens diabetes. So that's also another benefit you will get. So you take really 2 meals in a day. In the night, you take a double dose of the fat reducer, and the reason for that,
pills too,
well, you have it as a candy form, and you also have it in the liquid form, so 2 teaspoons or 2 candy or a mixture. Most of your fat is actually burnt at night. It's not really burnt in the day. The body tends to want to use glucose in the day. For the first 12 hours of the day, it's using glucose. So we have this double dose of fat reducer take at night, so as to increase the accessibility overnight, so you can burn more fat. If you're burning more fat, obviously you're going to improve your.
Right, that one is amazing. You burn more fat at night.
Right.
Sleeping.
Well, yes, because if you think about it,
so you don't need to exercise. You just need to sleep as much as possible. And you just shed the weight.
Well, most of your weight is not. You're not going to lose most of your weight from exercise. I mean, if you put the maths to it, you realize that exercise is contributing a small portion to your net output. If you exercise, a typical person exercising for an hour will burn like 200 calories. Okay, if you are eating in the right pattern and your body is regulating the system and changing parts and so on. Let's say a person with 100 kilogram weight. All right, that person will be burning somewhere in the region of probably about 2,500 calories, just maintaining his system, changing his parts, and so on. Now, if that 100 kilogram person exercises for an hour, he will burn to 250 calories. So he's burning 10 times more calories if he's operating his system right, versus what he will burn in exercising for an hour.
When operating the system right. The traditional Jamaican thing, another tradition is to eat a big dinner.
Well, you don't have to worry about the big dinner. The main thing you have to worry about is the big breakfast. What the breakfast is doing is setting the body program for the next 24 hours. Once you eat a heavy breakfast, remember I said you have this destructive hormone that comes out in the morning, the cortisol. It's running what we call a circadian rhythm. It comes out at 8 o'clock, stays till 12, then it disappears. Now, if you eat
eat the breakfast too late, then
if you eat it too late, then you will not influence that hormone. The hormone is going to set the course.
It has has to be like between
before 12, between 6 and 12.
Okay.
Once you eat a heavy breakfast between 6 and 12, you literally switch off the destructive program, and you turn on now a constructive program, so your body now start to put in new parts. But then the body can't keep putting in new parts if you're not taking out the old parts. So the day you fast, it's like a day you're going to fast, so you're not eating anything before 12. So you're now allowing the steroid now to rule, and it's going to put the body into a destructive mode. So as a result, you remove some old parts. So because you remove the old parts, the next 6 days you're putting back some more new parts. Now, what you're seeing is a construction activity. Construction activity is very expensive, and the currency for the body is calories. So you're going to use a lot of calories turning over those tissues, repairing, putting in new parts, and so on. And that adds up to about 25 calories per kilogram weight. So as I say, if you have a person who's weighing 100 kilograms, that's 2,500 calories. But if you are exercising for an hour, that's 250 calories, you know, if you do a really intense exercise. So you have to exercise 10 hours to achieve what you can achieve just by eating right. So as you can see, exercise is not really for losing weight. Exercise is really for improving your effort tolerance and your fitness and so on.
The cardiovascular
function, respiratory function. Yeah, that's exactly.
Just talking with you, Robert, it seems to me that you guys have done a great deal of research and development. Tell us a bit about ImmunoVenture, how it began, and the extent to which what you put on the market passes through the normal certification process that the public can be assured that is not, some kind of bogus thing.
Okay. Well, in terms of research, I've been researching diet since 1989. From when I was back doing my postgrad in medical school, I've been researching that and looking at the issue of what I call diet schedule and the effects on the metabolic system. In 2003, I wrote a book, The Sabbatical Diet, which I published, and so on, which says that basically saying what I'm saying about the diet and how it affects your metabolic system and so on. ImmunoVenture products, though, didn't start until 2006, when we also noticed that by adding prebiotics, which is the product that neutralizes the effects of the preservative, we started to see the benefits in terms of health and so on. I myself used to suffer from severe rheumatoid arthritis from about 1999, and then I started to use the product from about 2004, and currently I can say myself free of rheumatoid arthritis. In fact, I had severe rheumatoid arthritis. It was very restricted in terms of my activity and what I could do and so on. So we started the product mainly as a prebiotic, and then we have expanded now into other areas, as I said, in the fat reducer. We're also looking at things like stem cell function, brain maximizing brain activity function, and so on. Our products are certified by the Ministry of Health and also by the Bureau Standard, also certified our factory.
What about the American?
We have also had approval for 4 of our products by FDA, which is currently available in Miami and so on.
Well, we have to end it there this morning. But extremely interesting. I'm sure listeners would have learned a lot, particularly on that breakfast point that you make, because again, this coffee and toast business, and then you eat a 10-course lunch and 5-course dinner is not the way to go.
Right. Well, just make sure you have a heavy breakfast. After that, you allow your feelings to guide you. Allow your feelings to guide you.
Careful,
Don't worry.
Okay, good.
Robert Robinson, ImmunoVenture Product CEO, thank you very much. Really appreciate it as usual.
Thanks for having me.